Hello, my name is Christine Sutherland, and today I'd like to introduce you to Deborah and Jose Forciero and their to be expected 3 weeks from now baby. And we're going to be doing a pregnancy massage that will include those tired feet and achy legs, and we'll also massage the abdomen and show you what you can do in the upper trunk, chest area. We'll move along to the arms and we'll show you a sideline position for doing the legs and hips and the back. And we'll include some techniques that you can also use in the labor and during delivery. Are you comfortable and ready to go? Mm-hmm. Great. We're going to start our pregnancy massage by massaging Deborah's legs, and I'll give Jose just a little bit of oil to get us started, and you can rub that between your hands. And then we're going to start at the feet, and you can sandwich the foot between your hands in a prayer position, and then come on up the leg like this and right up and head for the outside of her leg, and then glide back with a hand on each side. This introductory stroke is called effleurage. And we do it usually about 3 times, and you put pressure up towards the hip. That's right, and glide back without any pressure. And we elevate the feet, as you can see, and the whole lower leg so that we'll get some postural drainage and allow the fatigue products to just flow back into the trunk. That's great, Jose. And this time when we go up the leg, for those that are massaging along with us, we're going to stop up at the very top. Put one hand on top of the other, and we'll just go around the head of the femur. That's great. And you can be quite firm. You can press into it. That's good. And you can step a little closer to your hands, Jose. Come up a little closer. That's it. And then you don't strain your back. For those of you working on the table or on the floor, just adjust your posture so you don't hurt your own back, giving them a relieving massage. And then come on down the whole side of the leg with that stroke right to the knee. Yep, that's good, in circles. And all the way up again with circles. And this reinforced palmar kneading is being applied to the iliotibial band, a band of fascia running down the outside lateral aspect of the leg. Gets real tight when you stand all day, even if you're not pregnant. Okay, and then we'll go into some ringing, where we take the whole upper part, that's right, and don't be afraid to really firmly ring it together. That's great. How are we doing, Debbie?
Good.
Is it equal pressure?
It is.
And that's the only thing you have to adjust at home, folks, is ask the person on the receiving end about pressure, and they'll tell you how firm or how light to work. And come on down to the knees. And let's do a thumb kneading all around the upper part of the knee. And often the knees feel very sore and fatigued. They're the greatest weight-bearing joint in the body, and they're carrying extra weight all throughout the pregnancy. So working all around these muscles that go into the knee joint is really important. Massaging the lower extremity is extremely important for helping prevent varicose veins and also relieving any problems with circulation, so that often people don't have any circulatory problems until they're pregnant, and then they really feel tiredness and heaviness in the legs. So we start with this segment of your pregnancy massage because doing the lower extremity is one of the most important aspects of the whole massage routine. Now, this is going to be a little tricky. This is a big thumb kneading that goes right around the patella. That's good. And you can step a little further back towards the leg, Jose, and you'll line up. Yeah, a little easier on that. And then let's use the same thumb kneading, and we can stand right down here at the foot of the leg. So just come right around to the end. That's it. And we'll work right down. What a team.
What a team.
Yes. And we can go on one side of this tibia and then go on the other side. You sort of have to tuck your thumbs around. That's right, so you can go up that side. It's a little awkward because most of the muscle bulk is to the back of the leg, but it feels very good, doesn't it, to work the fronts. Often the arches get strained and they fall a bit, and this front muscle, the tibialis anterior, gets really sore and stretched out. And let's go into the ankle now, and right around these bumps. These bumps are called malleoli, and this is very, very relaxing. And then take both thumbs, and you can go like this. That's it. That's great. Very nice. And come on down the front of the foot with the same stroke, alternate thumb kneading. And you could do this a lot, folks, at home. You could spend twice as long as we're going to on the feet. You can just stop the video and massage away. It's very nice to have a cold foot bath before the massage or afterwards. It sounds horrific for someone who isn't pregnant and delicious to somebody who is. And let's corkscrew each toe. They often get puffy and sore, and it's amazing how thorough you can be with your foot massage by just doing each toe individually. That's great. And then let's do the sole of the foot. And this again is going to be an alternate thumb kneading right down, right into the heel. And it's often the heel of the foot that feels really sore from pounding away on it. And once again, they could take about 20 minutes of this, but we're going to move on to the next. And you can do this stroke that we started with, Jose. And this time we're going to do an ankle rotation by leaving one hand on the ankle and slowly going around 3 times in one direction. That's good. And then reverse and 3 times in the other direction. Remember, this is just for demonstrating. You can do this 10 or 20 times in either direction for the person who is underneath your fingertips at home. And then let's go up the leg with our effleurage and really lean towards the hip and glide back along either side. And we'll finish up with some light stroking. This is often very useful during labor. It's a technique that's often used as a relaxation technique so people can sense what part of their body they can relax systematically and let go of the tension. So it's like a touch relaxation. It's called reflex stroking. And this whole leg routine can also be used in the early stages of labor to help relax the whole area right up around here. And the more relaxed the person is, the smoother and more expediently things go. There we go. We're now going to be massaging Deborah's abdomen and the baby on the other side. Here, I'll give you a little oil. And we can start with this sort of stroke where you chase one hand with the other. Put your hands right on top of mine for this one, and we'll go around. So one hand stays on all the time, and the other hand hops over. And it's called a overhanded palmar kneading, which is just like it is. And there you go. You can just keep going. That's right. Don't be afraid to be quite firm, Jose, and come a little closer. That's lovely. That's very good. And you can go way around the perimeter, the outside edges. That's it. Very nice. Good. Okay, and then I'm going to do a stroke that we haven't done as yet. We're going to introduce reinforced fingertip kneading. And you'll notice that I'm going to do all of the outside edges of the abdominal area. Are you comfortable, Deborah, with that stroke? Especially this side is the descending colon. Some people get constipated. That isn't one of Deborah's problems, but I just want you to see that it's all this side that you pay particular attention to, and these corners or these flexures right here. So I tend to go in the direction that it likes to flow. So reinforce your fingertips and make little circles, yep. And that's good. Don't be very generous. Make it stingy. That's it. And be right on the tips of your fingers. Yep. And you can work all around, right at the lower angle of the ribs. Often the baby sits quite high, and in the second trimester it feels like you can't breathe very easily. And this is a very nice stroke for relieving that feeling of having your breath cut off and give a little bit more elasticity to this costal angle. That's great. And then you can go back to that palmar kneading like this, where you go one hand over the other. That's good. Now some people swear that they can chit-chat to the baby inside this way. And I think probably parents can do all sorts of things like that. But we're just going to finish the abdominal area with some fine vibrations, which are like this. And this looks like a coarse vibration because fine is a little bit more modified. And just try that. It's sort of like getting nervous, yeah. And then really fine. That's it. That's like humming. That's right.
That's right.
Okay, great. And then for the costal angle, I do a long stroke with my thumb like this, and then this fingertip kneading, single-handed fingertip kneading there. And just try that, a long stroke first with your thumb right along the angle, and you sort of open up your hand and let it glide along. That's right. Yeah, nice and slow. Yeah, that's good. And then the fingertip kneading to the edge of the ribs. Yeah, that's very nice. And follow them all the way along there. Sometimes these floating ribs get very uncomfortable, but when you're working back there, it's also quite relieving to the lower back. And I'll show you the stroke that we can usually classify as a favorite of people. This gets right around to the lower back, and you sort of lift, and you ease off the pressure as you come around to the front. So you get way back there, and then pull. That's it. And go slow so you get lots of stretch. Does that relieve the lower back, Deborah?
It really does. Mm-hmm.
Okay, very nice. And then I'm just going to demonstrate too how you would work around the breasts. And sometimes for people this seems to be the most problematic area. They get very big and heavy, and the side ducts all in here get engorged, and you can use this fingertip kneading all in that area. And you can also do a scooping like this. You just don't press on the center of the breast on the nipple. And when the breasts are getting large, we do a cold towel wrap where you soak a towel in cold water, and then you form a wrap like this where you wrap up the breast, and it sounds terrible and it feels wonderful. And there's different ways that you can wrap. You can wrap them in a figure 8 like this, so that you can have the breasts wrapped while you're doing the abdomen, and then they're nice and cool, and then you can do the breast massage. And there's a way that we can do an effleurage that is the whole frontal aspect of the person, right up and down the sides and up and then again. So just try that, Jose, where you come right off the top. Very nice. Right up and way out the shoulders, and then glide back along the sides of her. Yep, and you can keep your hands coming further way back there and then up the front. That's good, and try it one more time. Very nice, yep. And press out to the shoulders. Yep, and come way down the sides. Yep, and really grip at the back. Very good. Terrific. So that completes the abdominal area and the upper part of the front, and puts it all together with an effleurage. How are you feeling?
Great. Sleepy.
Oh, good. The arm massage will start with an effleurage coming right up the arm to the shoulder, and then glide back without pressure. And again, we usually do this about 3 times, and you push up and then glide back without pressure. And this time, Jose, when we get up to the shoulder, let's stay there and go around the shoulder with a palmar kneading, single-handed. And once again, we're opening up the circulation, starting at the top to the whole upper extremity. And then you can bring that right down. You can hold up her arm so that you can get to the back. And just palmar knead the whole upper part. And then let's go and palmar knead the elbow. It's a little tricky to do, but it feels wonderful. Right, Deborah? Mm-hmm. So it's well worth it. That's very nice. Okay, and then we can put the arm down on the table or on your bed at home and alternate thumb kneading. One little thumb makes circles covered up by the other one all the way down the bicep group right to the inner elbow. That's lovely. You're doing a great job. And then come on down the forearm, and you can do the back of the forearm. Same stroke, alternate thumb kneading. That's wonderful. And be sure and check your pressure with the person on the receiving end, and then you can go back up. So how's the pressure, Deborah?
Wonderful.
Good. And then turn over the arm like this, Jose, and we can do the inner arm. Now this is a wonderful massage when labor is starting, when you've got lots of time and you want to really relax the person as much as possible, so that this is a massage that keeps them glued in one place instead of pacing around. And it also seems to be very relaxing. Turn the hand around like this, and we'll go into the palmar aspect with an alternate thumb kneading right into the base of the fingers, and then turn it over like this, and we'll alternate thumb knead. Again, all the little bones and ligaments, tendinous attachments around the wrist, and then right into the top of the hand. Now, if your hands get sore, you just shake them out, because sometimes your thumbs might cramp when you're not used to this. And then we'll corkscrew again, each finger individually. And sometimes their fingers get as puffy as their toes, especially in the last month. Their rings won't come off, or they'll notice in the morning their hands are quite sore. And this is a very relieving massage for any sort of congestion or poor circulation in the upper extremity. Some people get severe arm and hand pain, so it's a good part of the massage to always include. Okay, and then let's finish with an effleurage. All the way up, glide back, and again. And then just put the hand down against her, and we'll have a light reflex stroking. Once again, this is a very good technique for labor, for touch relaxation, getting the person to breathe deep, and just do these light strokes if you forget all the rest of them. And just take a good deep breath, Deborah, and just breathe right into your arms, and just feel all the sensation, and just let yourself relax as we stroke the arms. Just let all the tension fade out of your body and sink way, way down. That's great. This sideline position is usually very comfortable for people for the lower back, and we're going to make her even more comfortable by putting a pillow underneath her head. And I'm also going to put another towel on top, Deborah, so your head can be as high as possible. Then I'd like you to keep this lower leg straight. Thanks, Jose. And we're going to put at least 1 or 2 pillows in, and try that. And I'm just going to bring this pillow around again because I want to get your knee as much at a right angle here. And the knee is high at the same level as the hip. So if it was lower, you'd have a twist in the back that you don't want. Now, this is the perfect position for being able to massage the legs and being able to massage the back. And from this position, I'll show you how you can do the ringing all the way down the leg, right down into the calf, and you can work from the back of the person. If they're in a bed, this might be most comfortable for you to work. And you can work then right into the hip and all the way down the side of the leg called the iliotibial band that gets really, really tight. So all of the wringing and the kneading to the leg in this position is going to be very good for relieving all the fatigue products right down to the foot. And we'll continue on with the next portion of the massage using this pillow positioning. So be creative at home, use all sorts of pillows. You can also sleep like this, and it's very comfortable for trying to get a good night's sleep. You can also use your partner's back, but often they would rather you use the pillows instead so they get a good night's sleep. This back massage is one of the favorite massage routines for anybody who's pregnant at any stage of the pregnancy, but especially in the later stages, the last trimester. This sideline position is very relieving for lower back discomfort, and also in the midsection of the back. There's often a lot of tension right around here because the breasts have grown and the dynamic tension all through the back is changing, so that often people become a little bit more round-shouldered than they would like to be, and there's a lot of muscular pulling up here. We start with an effleurage, and then we go into a wringing all the way up and down, transversely massaging the long spinal muscles that run parallel to the spine, giving them a good twist, and then getting right up over the shoulders and working right into the upper trapezius and right over. And you can do both sides of the back, even though the lower side is a bit more awkward. Remember, use your body weight, lean into the massage, use all the weight that you've got. And the upper part of the back is very easy to massage, but you can turn the person over and also repeat exactly what we're doing so both sides feel well balanced. But often the person is stuck on one side, especially during labor. They don't want to move to the other side. And this gives you a chance to do both sides at once. So I encourage you to use the whole back when you're massaging in this sideline position. And we go right into a specific stroke called alternate thumb kneading, looking for those sore spots all the way up and down the erector spinae muscles. And you can tell when we find some sore spots on Debbie. She responds right down here below the waistline into the lower back. This sacrum is right in here, and the sacral area is a great source of tension, especially the sacroiliac joints here, and you can thumb knead along those joints quite firmly and get a very nice response in the lower back. And this is very good for when the person is in labor, the early stages of labor, and all the way along right to delivery. You do these long muscles that run up and down either side of the spine. And you can give 2 and 3 minute massages, as we've done here, in between contractions. And then if she was getting a contraction, most people can't tolerate a lot of movement, so we'll just stay steady on that spot and pretend you're having another contraction, Debbie, and we'll just go right through it. And as the contraction gets stronger, you get more relaxed, and focus on your breathing. Breathe into the pain, right into the sensation, let it fill you up, and keep your body loose. Keep every muscle loose, and I'm going to push as hard as I can on the lower back. Keep breathing steady. Let your fingers relax, your whole arm. That's good, all the way down your back. And as the pain peaks, your relaxation gets even deeper. And let all your muscles relax all the way down to your toes. And then as it eases off, I'll ease off the pressure, and I'll give you a quick mini massage with contact and light stroking in between the contractions. And we'll just get rid of all the residual tension out of your muscles. And remember, the more relaxed you are, the more efficient the contractions can become to help push the baby out So it's like you want the pain and the sensation to be strong, but to be relaxed with it, which is a catch-22, but the massage really helps to integrate those two principles. As the sensation gets stronger, you get more relaxed, and we massage you to help encourage you in that direction. And we'll just do some light fingertip stroking to finish off. And the stroking that Jose is doing to Deborah's head is one of the nicest aspects of the massage, letting all the tension be released. And often it's the part of the person's body that they can take the most massage over a long period of time, is that sort of stroking through the hair and the scalp. And then you just keep doing that with each contraction. You just press hard and you verbally coach her through it. And then in between the contractions, just let her have a nap. And all those 2 and 3 minute naps add up so she isn't as fatigued when it comes to the pushing and the real work, where you don't have to be relaxed and you can get up and really use your muscles. But for the labor part, it's a matter of just keeping her relaxed and keeping her massaged. How are you doing down there?
Sleep.
For you folks at home, I'd like to remind you that during this pregnancy massage, Jose and I have been acting as a team, a good team, thank you very much. We've each done a leg, and we've each done an arm, and we've taken turns on the abdomen and the back massage. But what I'd encourage you to do is stop the tape and rewind it and be able to use it creatively so that you can do 2 legs and 2 arms and take lots of time doing the back massage. And remember, this massage you can take with you. Any delivery, any long labor is a welcomed spot for doing lots and lots of massage. The more you can relax the person who's in labor, the easier it goes, and the more they can tolerate what's happening to them. So I'd like to thank Deborah and Jose, and congratulations and good luck to you. And remember to rub them the right way.